welcome to the sixth webinar that we have done that focuses on the COVID pandemic and emergency and on faith responses. I'm Catherine Marshall, and I'm at the Berkeley Center at Georgetown University. So I'm sitting in Washington, D.C., and also with the World Faiths Development Dialogue. And I'm joining with our partners who are also the Joint Learning Initiative on Faith Responses, and Dave Robinson, who is independent but has a long history with World Vision. So we launched very early in March a project to track and to learn about the responses of faith communities all over the world, particularly linked to development and humanitarian issues, as a way of learning and as a way of making sure that some of the lessons that have been learned from earlier pandemics are in our minds and are reflected. So I'm delighted to welcome you today, as I said, to this sixth webinar. This one is focused much nearer to home than the last one we did 2 weeks ago, which focused on Asia. So today we're looking very much to Mexico and to the US border, but Mexico also, and to Central America, where there are so many links. We have with us three colleagues who are remarkable, each in their own way. And what we're hoping to do today is to have a conversation where we're batting back and forth some of the questions that we have, some of the issues that are emerging, and hopefully looking with some hope. One of our participants reminded me towards a better future. The three people who are on your screen are, first of all, Jorge Vivanco, who's the president of Zocara, and who has been, and I think still is, the chair of the World Vision Mexico Board and Vision Fund Mexico. Benjamin Laniago is the Secretary General of Cadena, a humanitarian relief agency, and he's based in Mexico City. And third, Dina Buchbinder-Oron is a social entrepreneur in many senses of that word. She's also clearly, she still qualifies, I think, as a youth leader. And she has done many very interesting things that include her own organization that she founded, which is Educar para Comprender, which is Education for Learning. She is based in New York. The other two, I think, are based, both of you, in Mexico City, if I'm not mistaken. So if I can, what we're going to do is start with some initial questions, have a conversation among ourselves, and then encourage you to use the Q&A function, which you have on your screens, to raise questions, which we will get to as many as we possibly can. And I know that we all have many questions, so let me start with asking Jorge, if you can give us your sense of what is happening, first of all, I guess, in Mexico, but also along the border. This is one of those things that scares us, that what was a dramatic crisis that we all focused so much psychic energy and attention on along the US border has almost vanished from the news. So I think we're very interested in what you think is happening. What are the trends? What are the big issues? So over to you, Jorge.
Thank you, Catherine. Well, to understand what is happening in Mexico in regards with this outbreak that we are suffering since last month of March, we have to take the whole picture and see that Mexico, it's a country where at least 300,000 to 400,000 people move from Central America to Mexico and most of them try to reach the US to get a job. And besides this amount of people looking for jobs, there is an amount of 400 to 1 million people, it varies a lot, since 1 century ago, moving also to the US, trying to reach the American dream. So it's a country where several hundreds of thousands of people are moving all the time, trying to reach the North American country. So starting the outbreak on March, the Mexican authorities declare one important action trying to stop that migration in the southern border and in the northern border. And this because of some agreements they reached with the Trump administration. And they have deployed around 5,000 people of the National Guard in the southern border and 15,000 in the northern border. And they have of course, braked this migration. The estimations are that this migration has decreased to at least to 1/3 of the regular numbers. And so the migrants, although they are still entering into Mexico and many are still entering into the US, it has been stopped this movement of people. So this reduces the risk of the COVID-19 outbreak. Now, what is happening in the borders? In the borders, there are two big branches. One is the official maneuver of the people and how they are handling through the official hospitals. And the other branch is what the ONGs, the ACNUR, the OMS, World Vision, and many other organizations, and many churches are supporting all these people, trying to supply all the goods and all the resources to avoid and treat the outbreak. And this is an amazing effort that these ONGs have been doing. I just talked with the people responsible in Tapachula, is the southern border, and in Tijuana, which is the most important border with the US. And really the numbers they gave me are amazing. They are carrying like 40, 50 shelters in both borders. And they don't have almost no contamination of the virus. And all the cases that have been discovered are under control, and the people has all enough supplies in general. Where is the tragedy? The tragedy is all those thousands of people that do not reach these shelters, and they are somewhere trying to survive, waiting that the border could be easily trespassed, and they could go reach the United States territory. Nobody knows about these thousands because they are not in the shelters. They cross it, they don't have papers, and nobody knows about them. But we could be talking of hundreds of thousands of people that are just hidden in somewhere, waiting to the outbreak to decrease. So we are optimistic about the cases and the people we are controlling, but we are concerned about all other people that we don't know where are they and how is their situation in regards of the outbreak.
Okay, how is this being organized? Is this spontaneous or?
Well, let me tell you, fortunately, since 4 or 5 years ago, there is a very good coordination among all these organizations. I would say ACNUR, it has a strong paid role here, OMS, and World Vision, UNICEF, and many religious organizations. They have a board where they meet regularly, and they try, and this was the origin of this, they try not to duplicate actions. When I was in World Vision working on this program, we realized that in some areas, for instance, World Vision had a program controlling the weight of newborns. And one day we realized that some newborns, they have been controlled their weight by 5 different organizations. So we say, this is crazy. So we organize a board trying to say, where are you strong in? What area are you strong? So you take care of this, I will take care of this, and you take care of this. So we split the job, and this is making, of course, this more efficient. When this outbreak comes, we already have the board in the US border and in the Guatemala border. So they meet regularly now, of course, very often, and they report their numbers, they ask for help, they share resources, they share knowledge, they share people, and this has been working really astonishing, really.
Great, thank you. Benjamin, what about your perspective? What are you seeing? And again, what is the general situation, but also how are organizations that have a religious link working, and how are they working separately or together?
Actually, I think that the faith-based organizations have a huge work to do and a very central place in this outbreak. Because the issue that we have community, and I speak up by myself, my organization is Cadena. We are the humanitarian arm of the many Jewish communities around the world. So we can trigger a lot of help because we have the capability to work through a community. So my first point is I want actually every hazard, every disaster or crisis that we manage, I realize and I confirm myself that the faith-based organizations are very strong and have a very central place in the response. That's why, because we can grow immediately if we use our network. Okay, so the network is very powerful, and then we can manage even through countries, like in a cross-border strategic. So we can help each other a lot. Let's say, for example, we are dealing a lot with the migrants in the border of Venezuela and Colombia. Okay, so a lot. So now our place is to be like the mediator between the government, the migration ministry, and the people, because they don't know how to speak each other, you know? So they fight each other all the time. So we start working with them before the crisis, before the COVID. So they have trust, and trust is a very important word, because if the people trust on you, so when you need something and you want to implement some strategic in between, you know, the politics and the agenda and also the people that are suffering. So an NGO have the capability to do that work. And it's very important the place that we take, the role playing that we played at that time. And then now we are working very hard to convince the communities that are in the border, and also even in Bogota, so that they don't have nothing, and in the COVID they have nothing minus nothing. Okay, so and they don't have an idea how to rearm, how to rebuild their own lives. So we are making a lot of strategics, and we use another partnerships also with many other faith organizations. And we like to do that. We like to do that because everyone bring to the table and the best of the best that they can do. And then with a cooperation table and a very synergic way to work and leadership, we can reach a lot, and we can really impact the people and help them how to change the realities. No? So for example, in Mexico, everything that we done with a lot of partnerships, and we already have to deal with the poverty. And actually, it's a very important issue, because poverty, it's a chronic problem in Mexico and in a lot of the third world, no? As you know. And then with another hazard, with another crisis, with another element or ingredient, like the COVID, everything is more dramatic. But the base that we have in Mexico, like half of the country lives in poverty and doesn't have nothing to eat now. So our agenda, our strategic moves a lot from the humanitarian normally way of doing things. Like we normally, we don't deal with poverty, because an humanitarian strictly have to work with crisis and disaster, no, to reduce the suffer of the people, but with a trigger. We need a trigger to hope. But now the trigger is a COVID, and so the mapping and the let's say the scope that open in front of our eyes is huge. It's very, very big, because we can deal with poverty, and that's the way we are working now. No, so we're back to basics and give to the people safe and food, safe, shelter, and psychosocial work, a lot of psychosocial work around the world, and then and a lot and to fight also with the COVID, directly in the hospitals, give them to the doctors and to all the people that work them, the really heroes of this story, the properly equipment to do the job, and to do the job without being infected.
You've mentioned a couple of times networks and partnerships. Could you give an example of just one example of how that works, and really what's happened since this COVID crisis?
I don't mean like a donor. Donors are donors, no? Donors are donors, and we have a lot of alliances with donors. But partnership, for example, it's another NGO that's called ALMA. ALMA is a very, very good NGO in Mexico that it's also from the Jewish community, that they work a lot with health, a lot with cancer. And so they have the map, the beautiful map of the hospitals and everything that we didn't have. We didn't have it because normally we didn't work there. So we make an alliance with ALMA and Cadena, and then we start working, and really it was very, very success. It is now very, very success. We are giving those equipments to more than 14,000 equipments for the hospitals in Mexico. It's thing that this achieve is very, very big, because the government is not doing the job that should be. So you can imagine in the third world, it's not logic, but the doctors doesn't have equipment how to treat the patients. No? So we are dealing with us. We are also giving food to the people that are outside the hospitals, waiting for their families, so the relatives. So we are giving thousands of meals, hot meals every day. So it's also all the mapping that we do with the help with ALMA. So it's an example that when we have trust each other and everybody put the best of the best that they can do, so the achievement is huge.
Mm-hmm. Great. Well, let's turn to Dina. You have a broader picture of civil society. How are you seeing civil society organizations responding both in Mexico, but also along the borders, because there are several borders, as has been highlighted here. And how does the religious community integrate and enter into this in the situation now?
Yes, thank you so much, Catherine, for this invitation. Actually, I agree with Jorge and Benjamin. I call it the pandemic of pandemics, because as Benny said, this COVID crisis is triggering a lot of and exacerbating a lot of other dire situations that we already have been experimenting, like poverty, like violence, and those that lag behind in a critical way. So I think I would like to share the thought of being so interconnected and being for the first time probably as aware as we are, because it's evident, it's shaking us all. We are all in the same storm. Of course, it's important to say we are on different boats or ships in this storm, and some don't have ships, some don't have boats, or their boats cannot navigate through the storm, and some don't even know how to swim. So that means no resources, and they're left to drown. So this is exactly being evidenced by the COVID crisis. And I see as in a very broad perspective, 3 experiences from the NGOs, the civil society organizations. One is the ones that have the nature of their work is research, and so they can continue doing what they did. They stay at home, probably they research, and they have the funds to continue their research as far as, for example, the end of the year. There is a second category of organizations that work on the field, like Education for Sharing, and like so many others that have had to stop completely their programming and have had to reimagine and rethink how is it that we can be of service, not being on the field. And the third one is, so those who have the privilege of having the budget to continue, even though their work on the field has stopped. And then there are the other less privileged organizations that have to stop completely because they don't have the funds to continue if they don't do what they have set their mission to be. So we find that a vast number of not only businesses and companies, but also non-profit organizations are really having to close their doors because they don't have a way to survive. And the focus, of course, right now is absolutely in the most urgent matters for ensuring the survival of people. So this is one of the aspects. And then it's also fascinating to see that this is a very cultural phenomenon in the sense that different value systems and different meanings that we give in different countries and different even religious-based organizations. So for example, some cultures, maybe like Italy or Mexico, vis-a-vis Japan, China, or Korea, may take a complete different approach and therefore have very different results in terms of making sure that they're controlling the spread of the virus. And similarly, I also want to acknowledge, for example, the effort, going back to Benny's point, to the Jewish community in Mexico and in the world, is like the one example of so many that when you are coordinated and when you can take decisions that affect your entire community for the better. For instance, from one day to the next, literally, all schools, all community centers, all synagogues, and every single space where people met in the Jewish community were closed, like that. And they also were able to come back to reinforce the community with all sorts of different activities online, concerts, events, conferences, so that they could nourish at home this lack of contact, physical contact. So I think most of the organizations have had to reinvent themselves very quickly, as quickly as they could had ever imagined, which is one of the positive aspects of this crisis. Crisis make us change. No, this is like by definition the opportunity that lies in crisis, that it really puts us to the limit and pushes us to go beyond, to strive forward the status quo. And so I think there is a huge array of efforts and offer out there for people to do at home. And specifically looking at the aftermath of the COVID, which will have a lot to do with mental health. I think as much as we can preserve in the current moment the mental health of families that were already stressed, but now are hyper beyond that normal level of what they're used to. And I think that is the work that many organizations are trying to come up with, a way to become digital. And this is our own personal case in Education for Sharing.
Yeah, I'm interested in that. How you focus a lot on children and on schools. So how have you and your organization adapted to that? And how do you see the issues for children?
Yes, we worry most of all, what I think would keep us at night from sleeping is the fact that we know firsthand and the statistics don't lie about the children that live violence and abuse at home before the COVID crisis. Now, of course, this is one of the aspects that are most exacerbated because, as I said, parents are more stressed out. They don't know what to expect. Uncertainty is like at its peak. And so what we are focusing is on how to better serve families now that they are at home, and to provide resources that are practical, fun, meaningful, healthy, and that can provide an atmosphere at home, an environment that is more prosperous and more really geared towards providing a sense of resilience for when we come back. Because most parents, believe it or not, because we have to work all day, every day, and we need to survive, we are not used to spending so much time with our children. And many times we don't know what to do with our children. And we have to cope with working from home, etc. So I think this is a very broad reality, and we need to acknowledge it and be nimble to provide what parents can use today so that they can themselves, it's like the plane where you put on the mask first to save your children. It's the same, is you have to be in a minimal condition of mental health, at least, to provide that to your children and to your families, your surrounding. So we have really crafted a whole lot of stay at home. We have a campaign, Stay at Home, and so many organizations have also gone into this effort of creating very, very suitable activities, tutorials, experiments, games for families at home.
Jorge, you've also focused a lot on children
Yes.
over many years. I'm interested in what kind of adaptations and as well as what kind of challenges are you seeing specifically for young people?
Well, as you know, World Vision, as many of the ONGs that are involved in these boards, are focused on children. And our main activity in general, the last year has been advocacy activities. So protection of children, this is the very first priority for us. So during this outbreak, we had to change, of course. Now our first focus is to keep families together. The second is, of course, sanity, health. And the third is how to keep children active, education, recreation activities. And then the fourth would be all the others. But we have to change all the order of activities that we used to carry in the past. World Vision has been working in very well-trained people who can handle groups of children, and they can keep them moving throughout all day. And this is amazing. I was witness of this activity they had during the earthquake we have in the 2017. We visit with Jean-Francois, the epicenter of the earthquake. And it was amazing, the job they are doing. For instance, they take this time to teach children music, or they teach children what they should be learning at school. So they adapt it with games, with physical activity. And this is also part of keeping them health, because you know the immunity system needs to be in touch with the earth, with the air, with the water, so that it can be reinforced. And I guess this is a very good achievement, not only of World Vision, all the organizations that are working with children.
Benjamin, among all the groups with everyone challenged, so many, the numbers are terrifying and mind-numbing. Are there specific groups and communities that you're focusing on and that you worry most about? Children,
Yes.
older people, indigenous communities, some of the logical ones that we know about.
We from the beginning of the COVID, we start with a mapping to map the most needy people. Okay, so we focus always in the most needy people. Let's say in a hazard, in an earthquake, in a hurricane, in a civil war, anywhere. So the most needy people for us, the mapping was like in a few groups. Like first of all, the old people. Okay, the old people. So we start right away to make a beautiful program that makes like a companion, a volunteer of Cadena, to old people that doesn't have family, doesn't have nobody that procure them, like really engage him or her like every day to secure that he or she is okay. No? So to prevent depression, to prevent sickness, and to prevent death. So we have a beautiful program that we are rolling very, very, very well. And then it was so successful that the government took this program, and we are now launching this program in a national way. Okay, so it's a very, very good one. And then we start moving to the most needy people that, you know, the multi-hazard, this is a multi-hazard problem, you know. It's a systemical vulnerability that we are facing. Let's say poverty, and then we have no jobs. And then now we have hurricanes and a lot of floods everywhere in Mexico. No? So Mexico, it's a really interesting place to solve problems because we have many problems. It's a systemic, always we have a systemic risk. Okay, so we are dealing now and facing systemic risk. So for us, the most vulnerable people now is you know, that they are facing extreme poverty, no work, and then natural risks. And we have now launching a lot of alerts and response. We are first responders, like we go to the field. And actually it was also, I want to make in a parenthesis, like regularly, when you are making, you know, when you are doing humanitarian, you are in a good health, in a good situation, in a good status. But now everybody's in the same boat. Everybody's in the same channel. Everybody's vulnerable now. No? So to work now and to go to the fields and to help people, it's a really, really heroic action. Okay. So the humanitarians, in my perspective, we have to do that. Like the doctors are doing the job in the hospitals, the humanitarian, we need to do that in the field. So we are just going out and all over the country, all over, no? In Chiapas, in the borders, in Zacatecas, in Tabasco, in the southeast. It's amazing how big is the need there. No, so now, for example, we are making a partnership with World Vision, Save the Children, and Cadena to raise an alert in START Network in London. That we are part of the START Network. That they have the START Fund, and they can you can launch raise an alert, and they can they do funding project by project and now in this case is for all the peninsula of the southeast, like the Baja California, like Quintana Roo and Yucatan, every place that they are facing now a lot of suffering because the hurricanes. So in the COVID situation. So it's a multi-systemic problem that we are facing. And then this is another group, no? A big group, very, very big group. And also the families, we are helping the families all over Mexico with a project that names Call. It's a call center, you know, and it's a very charismatic one because you can call or you can join by a bot in the WhatsApp, and we have hundreds of professional volunteers that are receiving that calls. So we can bring psychosocial support to prevent violence, to prevent depression, even everything more deep, more you know, things that can go over control. And then also we have like spiritual leaders from all over the religions. It's a beautiful practice. So if you are Christian or you are Jewish or you are Muslim or you are a Buddhist or you are atheist, you can call and you will have support in a spiritual perspective, and also an medical orientation. Why medical orientation is very important? The people in Mexico doesn't know when to go to the hospital. So people die in the houses because they don't know when to take the decision to go to the hospitals. So this is the tool that we are managing, and we are saving a lot of lives every single minute, every single moment. So I see this like a war. You know, we are in a war with the COVID, and this war have a lot of different risk in a 360 degrees. So we are facing each one's and do our best to to face and to help and to reduce the suffering of the people in a lot of ways.
Well, I would like to start turning to some of the questions. There are a couple of questions that are coming in, and I encourage any listeners to go to that Q&A function at the bottom and to put your questions. A number of people are asking for details of the programs that you've mentioned. So what I could commit us to is to collect those. So for example, somebody wants to know the name of the board that's comprised of different NGOs and more information about it, and the elderly program for you, Benjamin, with government participation. But we can come to that, but also commit ourselves to collect this, because I think there's a lot of gold in what you're saying, a lot of information that's not generally available and that people are very interested in. Alvaro Albacete has a very specific question on access to water in the situation of COVID that's even more needed to prevent the infections. Are there any specific measures or programs? Maybe we can go through and see if any of you have anything to add there on water. Okay, so Benjamin, you can start.
We are distributing water filters in those places that I already mentioned, because when you have a hazard and a meteorological hazard, so all the water is contaminated. No, so they don't have money to buy bottles of water, and they start drinking from everywhere. No, so the sickness is just high and high and high and high. It's not because of COVID, it's because they not clean the dirty water. So this is a program that we are running many years, and in every response that we do, we bring the filters. We install in each house a bucket with a filter, and each filter can provide 800 liters per day. It's only for gravity. You take the dirty water, you put in the bucket, and only for gravity you can clean the water, and it's good for drinking. It's good for washing hands, everything that we need in hygiene in home. So this is very important. We are distributing thousands of these filters.
Jorge, do you have
yes,
any?
well, in terms of material support, we were just focused on two items. The first is to supply all people in the shelters sanitary kits, and we also are supplying pantries. So we want to be sure they have food and they have everything to be protected. And this in all shelters that are over 30 to 40 shelters that World Vision is contributing.
And
Yes.
Dina, any specific on the sanitary water issues?
I mean, on the we're not providing the toolkits, like the physical aspect of it, but I think it's as necessary. Sometimes you have the technology or but you don't have necessarily the know-how or the emotional capacity to deal with something, which also Benny made a comment about with the call centers, which is, I think, a fantastic initiative. I think sometimes something very hands-on that parents can actually feel like they don't have to know anything just to do it. That is a huge relief, and I think everything is complementing the possibility for us to grow stronger and to come back stronger from this crisis, and to prepare for the ones that are coming, because this is just, I think, a taste that we have to be prepared for in the world.
Well, that's a sobering note, but perhaps we can turn to some of the positive sides that all three of you have highlighted and mentioned. Obviously, the extraordinary crisis that we're facing touches everywhere, everyone, and all sectors, and it challenges every institution. But since you're on the screen, Dina, yes, we have all these gaps, and you've also highlighted some of the positive side, particularly the sort of enforced creativity, the need to come up with solutions to the impossible. But if you're thinking and looking in that vein, what might you point to as avenues for the future?
Thank you, Catherine. I think there is a phrase that I very much think about during this COVID crisis, and it's, the world is pregnant with opportunity. and it's funny because it's like bringing about the possibility of reinventing the system of systems. This crisis is, again, inviting us, pushing us to really rethink, reimagine, reprioritize what is it that we truly care about as humans on planet Earth, and why do we care about others? Why are we thinking, like, we always have heard the notion of, well, we are interconnected and what happens there has an effect here. But now is more evident than ever before, and it's really like a lived experience for all of us in the world, that the fact that somewhere in China is suffering definitely affects you on the other side of the world, and vice versa. So I think this is a very powerful message that we are learning collectively as community of communities. And so some of the most entrenched issues that we have been fighting against throughout the history of humankind, I think we can now really take a very refreshed look at it and say, you know what, this is our opportunity, not just to survive this, but to really go deep and take that deep dive and reset it, if you will. So this is one, the opportunity that with this new baby of the world that we can have, the notion of, like, the very tangible notion of how interconnected we are, and that we as humans do care about others and need to continue nourishing this aspect of caring. And then I think an aspect of hope, no, that we have learned so much in such very little time, we never imagined we could do things that we are doing, anywhere from using technology to reaching populations that we never reached before, anywhere from spending more time with our families that we never discovered before, what it's like to be on a daily basis like this, and to be able to actually get organized and coordinated and bring about a good, positive environment, to the climate change realization, no? That in such short time, we have seen huge gaps being met for the positive side. And so it's just like an invitation for being grateful, but more than just being grateful, is like we have the responsibility of being grateful. And with that responsibility and with the notion of finding ourselves being grateful, is always asking ourselves, how can we do more for the people around us and those that are not necessarily around us, but that are here.
Wonderful. Benjamin, I have huge admiration for people who work in the humanitarian field. It's such sometimes soul challenging work to deal with every disaster. And this is now the disaster of all disasters from some perspectives. But maybe what is your to-do list for the leaders of the world? What needs to happen, or to communities? How are you looking ahead?
I'm looking ahead in a very positive way, but I know that this process that we have to come through, it will be, hard. It's not like a smile and a happy face. Many people are suffering a lot. So in a perspective of leadership, I know that leadership have to be very strong. And you always have to take care about the well-being of the major agenda. No, the challenge is how to deal with the major agenda and to develop well-being for the people, and also to look for the details. This way, like the process that the most needy people doesn't suffering so hard. And this is a challenge. That's why we need to work together. Like, my message to the governments and the leaders of the world is that we have to work together and to understand that we are connected, either if we want or not, either if we like or not. We are really interconnected, and that's the way that we can also survive. Like the same thing that put everybody in risk is the same thing that we can take like a strength and to take to the other level, to respond together and to be co-responsible, but really co-responsible, and to respond to this crisis like a family. Because we believe, like the faith NGOs based in faith, in religious ideas, we believe in the human family. We believe in the common well-being. We believe in those. No? So this is a time when we already evolutionate our thoughts that keep us apart. And this is the time when we need to practice all the thoughts, all the ideologies, all the philosophy, all the books that we already done and read for 1,000 years. This crisis takes us to an opportunity to practice that. Not to mention that we are family, not to practice that we are one family. And so how we start? We start obviously with the circle. The most little circle is myself, and then my family, and then my community, and then my country, and then my continent, and then my world. No, but in that global perspective or universal perspective, we can deal with a lot of things, because the people have to be responsible and for each one, like for myself, and then to grow and grow and grow and share everything that I can share. And this is a very beautiful practice that humanitarian faith organizations are dealing with that. And this is my message. My message is that we need to be resilient. And to be resilient, we have to be adaptable. adaptable is one of the values for the human being, for the Homo sapiens, that took our species to the summit of the chain of the chain of the world. No, so because we adapt ourselves to the warm temperatures, to the cold temperatures, we adapt ourselves in many thousands of years. We are good in adaptation. So let's do that. Let's adapt ourselves to the things that we can do, and then to put a lot of resilience in our agenda. No, how to recover from this in a systemical way, not only with the health. We have to have, in one hand, the health, like the life, the value of life, and to be safe in that case, not to be contaminated by the virus, but also the well-being. We can't forget the well-being, because we are nature. Our nature is always looking for the well-being. Okay, so to say everybody go home for 1.5 years is not the solution. No, we have to deal with that. It's an art. I don't have the specific formula for that, but we need to have in the two hands the well-being and the health, and to secure that everybody will have access to that formula.
Wonderful. Jorge, what's your sense of what we need to do and how we can move forward?
Well, this season, unforgettable season that humankind is living. First, we're very sorry about the suffering that many has had, but we have to take advantage of this experience. I believe humankind has to reset their hard disk. We have to come back to basics, analyze, and really to consider the potential of collaboration and the potential of teamwork. I know these two subjects are constantly used in everywhere, teamwork and collaboration, but believe me, what we have seen, the results we have seen, it only shows us the enormous potential that humankind has if we really work together. So just let me give you an example of something I knew just a few months ago. And I just want to underline that the problem is not necessarily always money. I visited a school in the Mexican border with the US in Tijuana. It's a school with probably 1,000 students. And this school had a very low average of education. Let's say from 1 to 10, it was an average of 5. So they were very concerned about this. So they had collaboration with some schools that World Vision was working in El Salvador. And we learned from them this. In El Salvador, in every group of schools, they made an experiment. They say, from the 50 students, we're going to take the 5 with the highest rate and the 5 with the lowest rate. They teach these 5 mentors how to handle the things. And they ask the 5 with the lowest to pick one of these 5 mentors. And then every day, 1 hour before they ended, they have to close the class. They meet in one classroom, isolated, and every one of the mentors helped them to understand what they didn't understood during the day. Just like simple like that. No money needed. After 6 months, the average scoring of the school education raised by 25% with no money invested, just collaboration. We have the resources in front of us, just in front of our eyes, but we have to take these experiences to work together, collaboration. The tables I just mentioned of all these groups of faith-inspired organizations with ACNUR, with OMS, with World Vision. They have achieved astonishing results just with collaboration. We need to do that. We need to reset, and we need to come to basics to achieve what we really know. I also believe, Catherine, that it's important that the world has to review their values. We all have to review our values in our homes, in our jobs, in our ministries. This is something that if we don't do it now, we won't do it ever.
That's for another conversation to find out how we're going to do that.
Yeah.
But we're 5 minutes from the end, and I want to give each of you one last quick comment before we close, and before I make some dangerous promises of what we'll do next. So let's start with Dina.
Yeah, thank you so much. I just want to highlight that one of the things that I would very much ask for leaders in governments, in the different administrations, is to truly take into account a closer look to understand the dynamics of what people actually go through, and to take into consideration the needs of people and why they comply or not with what they are, the public policies that they are bringing out there. If people are not staying at home, to understand why are they not staying at home. For instance, in Mexico, we have half of the population working in the informal sector, and if they don't go, if they stay at home, they will not die of COVID, but they will die of hunger. So they live by the day. So it's important that when we launch this huge systemic rules, I mean, the governments are struggling a lot to find the balance between the sanitary and economic aspect. Yeah, the balance, but it's really, really important for, if you're going to make a sound proposition, to really come from a place where you are really in touch with the needs of what people actually are going through. So that's one. And then just to Benny's comment about not doing this with a smile or with a happy face, or, I mean, I understand what you say, and I am with you in the, and really with a heartbroken from all that people are suffering. But I am very hopeful that we will come out stronger from this crisis. And I just want to share a quote that I love from Desmond Tutu. It says, "Hope is being able to see that there is light despite all of the darkness."
Great. Benjamin, any last word?
Just to say to the people that are listening that this wonderful webinar, that I think that leadership is the key. Like leadership, we need to make, for me, you can see definitions of leadership, but for me, the leadership, it's the one that can make the things happen. So the commitment and the passion that we put now in this cause, and to understand that this cause, like to fight for the well-being of others, is the best way to do leadership, is the best way to give to our lives transcendence, and then this is for me leadership. So we need leaders. We need to think out of the box, and we need to be creative to bring to this reality different solutions, to reinvent, to reset many ways of doing things. But the commitment is very important, because it's not that we can do it in a short term. This crisis, it will take us a lot of time. So the commitment to be leader and to change realities have to be really strong, and with a lot of commitment to change realities. So that's my message.
Jorge, you gave us some very strong messages on collaboration, teamwork, networks in a very real way. Any one last second, last word?
Uh, if we don't change today, we will never change as mankind.
So this is the chance.
Yeah, if we don't do it under this situation, when we will do it? I don't see.
Well, most unfortunately, we've come to the end of the hour. So first, I need to thank the three of you for wonderfully informative and inspirational, as well as sober analyses of the situation. And it was really quite a remarkable set of very different perspectives, but with a lot of common threads between them. A number of people have asked for details. Your bios are on the website, but we also can provide a bit more information about the organizations. And on the specific programs that we were mentioned, I'll ask my colleagues to get the details so that we can then make them available to anyone who listened. And the recording of this discussion will be on the Berkeley Center website soon so that you can listen to it again. And I commit myself to looking through the transcript because I think that there are a lot of ideas here that I at least want to reflect on and want to use. So with many thanks, we will have our next webinar in about 2 weeks. I think the date is July 6th, if I'm not correct. And we're going to focus on that one on the issues of hunger and agriculture. But we welcome very much your ideas on issues that we should be looking at and topics, because as you've pointed out, this is a topic that covers the crisis that covers so many different dimensions. There's so much to learn, so many mistakes to learn from, but also visions and examples of practical hope. So we look forward to working with you. And again, thank you so much.